Gum disease is significant in that there are so many things that will make a patient at more risk for gum disease. I mean, for example, there's a lot of medical risk factors such as high blood pressure and diabetes and smoking that pretty much makes a patient more at risk immediately just when you have one of those three, and at least two of those three certainly. But there is a huge genetic component to gum disease too. So our goal is to first of all listen to the patient's concerns, but second of all to understand where that patient is along that scale of risk, and then sort of cater, sort of a recipe for initial therapy for that patient. And sometimes that can be conservative, cleanings or hygiene visits as patients have always had for every 6 months. But sometimes it can be, a little more of an in-depth cleaning because the problems happen below the gum line. And so the idea is that if we can treat the problems early on and really get to the problem, which is basically a bacterial infection, if we can resolve that, the quicker the better, because if we let it evolve, it becomes a situation to where we cannot be as conservative as we would want to be, and we've got to be in more of a surgical approach, which is no fun, and we certainly want to avoid that for all of our patients. But the hard thing about gum disease is that it's asymptomatic, so there's no pain, it's very few symptoms that patients experience along the lines for, as far as gum disease goes. So the only things we sometimes hear is patients will say, well, my teeth are getting a little loose, and that can be obviously a concern. And our patients may say, I have bleeding that's spontaneous, and that can be also, that's really only the two things that we hear from patients as far as gum disease goes. So more oftentimes than not, when a patient comes in and has very severe gum disease, they're in denial because they up to that point they've literally had no problems. And so our goal, going back to preventative, or non-surgical therapy, is basically to treat the disease as early as possible, before bone loss, permanent changes start to occur.